So, good afternoon and welcome to the Supporting Client Health and Wellness class presented by the Far Northern Regional Center's clinical team. My name is Nellie Camarena and I'm one of the RNs and work for FNRC in the Chico office. It's my pleasure to introduce the other members of the clinical team. If they are on, I'll have them just quickly show their video really quick. I'm not sure if Dr. Austin is on, our medical director. If not, we do have our RN in the Reading office, Jen Badger.
Hello.
Thank you, Jen. It's so nice to have all of you again here, and I hope that you find the information presented today useful in the day-to-day care of our regional center clients. As you know, our classes cover a variety of health-related topics that were identified by regional center providers, as well as health problems commonly faced by individuals that we serve. So today we're going to begin a part 2 of a 5-part series on the Fatal 5. But before we begin, I did want to give a quick update on COVID, just because I know that's something that's circulating in the news. I won't take too much of the time, but just wanted to give a short update on COVID. As you all know, there are various viruses circulating around us, including, COVID, flu, RSV. It's what we hear about in the news right now. With the colder weather keeping more people inside and with another holiday approaching, we just wanted to remind everyone that now is the time to get flu shot and make sure that you're up to date on your COVID vaccination, obviously, as well as our clients, making sure that we assist them with when needed in getting connected. So the updated COVID vaccines, the bivalent boosters, are formulated to protect against some of the more recently circulating viruses. And just like previous COVID vaccines, the new boosters can be given at the same time as the flu shot. So just a quick friendly reminder about that. I'm not going to read what's on the slide, but if you've got a chance to kind of skim through that, you can see that this just stresses the importance of keeping up to date on vaccinations in order to reduce the chances of becoming ill. Because as we know, vaccines continue to be our best defenses against these viruses. So there's my little spiel on that. Now we're just going to switch back to today's presentation on aspiration. So if you were here at our last class, you may recall that we talked about the Fatal 5, which refers to the top 5 disorders linked to preventable deaths in individuals with developmental disabilities. While the issues can differ in order or frequency, the 5 conditions most likely to result in death or health deterioration include bowel obstruction, which is what we covered last month, aspiration, dehydration, seizures, and sepsis. So today we're going to spend some time talking about aspiration. And so we'll go over kind of the same setup as last time, just going over the basic anatomy, in this case of the respiratory system, overview of the swallowing process, what aspiration looks like, describe high incidence of aspiration, interventions to reduce the risk of choking, and a brief overview on appropriate first aid responses to a choking incident. Okay. So very brief overview of the anatomy. As we know, respiration is the act of breathing. We inhale oxygen, exhale carbon dioxide, and the respiratory system itself is made up of the organs included in the exchange of the oxygen and carbon dioxide, which includes, the upper respiratory tract, which is made up the nose, mouth, throat, the voice box or the larynx, the windpipe, large airways, and, up to the trachea. And then the lower respiratory tract is made up of the lungs, the bronchi, bronchioles, and then the air sacs, which we'll dig into in the next slide. So when on the next slide, when we talk about what is actually the lower respiratory tract, You'll see that on the right side, the right lung has 3 sections called lobes. The left lung has 2. When you breathe, the air enters your body through your nose or mouth, and then it travels all the way down the throat through the larynx and trachea. Air then goes into the lungs to the tubes called the main stem bronchi, and then one main stem leads to the right lung and then one to the left lung. And then in the actual lungs, the main stem bronchi then divide into smaller bronchi, and then those bronchi divide into smaller tubes, or what they're called bronchioles. And then the end of the bronchioles have tiny little air sacs that are called alveoli, and you can see that on the right side, just kind of a zoomed in picture of it, where the actual exchange of oxygen and carbon dioxide occurs. So just a very, like I said, very brief overview of that. It's important to know what that looks like, because when we talk about aspiration and, you know, liquids and foods going down the wrong pipe, you know, it's all important to know where exactly the lungs, how the lungs play a role in this. So now that we talked about that, you know, this is just another picture that has, you'll see the larynx on the left-hand side here, and then the esophagus behind that. So why is it important to review the respiratory system when discussing eating and swallowing? Well, you've probably all experienced having food or a drink go down the wrong pipe. You know, and sometimes that causes a lot of coughing and just kind of feels uncomfortable. You know, I'm sure most of us have experienced this once in a while. But how do we know if someone's swallowing is actually appropriate or not, or they're having more frequent bouts of this? And why does it matter? Well, as you can see in this picture, our windpipe and our esophagus are both muscular tubes located within our neck. However, they have 2 very different functions. And so as we discussed in the last slide, our larynx and trachea are part of the respiratory system, while the esophagus back here is part of the digestive system. And so, with that, there are also different phases of swallowing, which we'll address in the next few slides. And so a swallowing problem can affect any phase of the swallow. And if there's a problem, there's also a high chance that this can lead to, you know, serious complications. So the swallowing process can be broken down into 3 stages. And so in stage 1 is usually, you know, what happens in the mouth. And what happens in the throat is the pharyngeal phase, or stage 2. And then what happens in the esophagus when we eat or, you know, drink something is called the esophageal phase. And then, as mentioned earlier, a person can have difficulty in any or all of the phases of the swallow. So it's actually really complex. So in the first stage, is usually, you know, your tongue collects the food or the liquid, food is chewed, mixed up with saliva. The tongue then moves the, when we talk about food being chewed up, call it bolus, and then it's moved towards the back of the mouth. And so if there's an individual that has an impairment in the oral phase, they might experience difficulty with, you know, creating a lip seal around the fork or spoon, you know, forming chewed food into a bolus, or actually moving it back towards the back of the mouth. And then some individuals might have difficulty with chewing itself and initiating swallows. And so all of this, if there's ever complications, can lead to, you know, like if someone's drinking liquid or water, it might, you know, prematurely spill into the pharynx, and then often resulting in aspiration. So there's, you know, different things, and we'll talk about that later on. What are some disorders that might affect this stage of the swallowing process? In the second phase, the tongue pushes the food or liquid to the back of the mouth. You can see a kind of a zoomed in picture here. This motion triggers a swallowing response, which passes the food through the pharynx, or the throat. And so during this phase, the vocal cords close to keep food and liquids from entering the airway. As a result, the larynx, rises inside the neck, and the epiglottis moves to cover it, providing, more protection for our airway so that food or water doesn't accidentally go down towards the lungs. And in this phase, if this particular phase is impaired, if food or liquid can move into the throat before the automatic swallow is triggered, resulting in food or liquid moving through the vocal cords and into the lungs. And then the third stage 3 begins when food or liquid enters the esophagus, the tube that carries food and liquid to the stomach. In this phase, the food is moved downward, and then the upper esophageal sphincter, you can see that labeled on this diagram, relaxes during this phase of swallowing and is pulled open by the forward movement of, we'll see a video later on, but there's a hyoid bone that's there. It kind of helps with that process. And then the sphincter closes after the food passes down. And so that, once the food goes into the stomach, the lower esophageal sphincter that you'll see down here, number 5, closes to then prevent reflux of the stomach contents from going back up. So if there's any impairment in this phase, it might result in like the retention of food and liquid in the esophagus after swallowing. This might result, it could be a result from mechanical obstruction or a motility disorder or an impaired opening of the lower esophageal sphincter. If the esophageal phase is affected, the patient, the client might also experience heartburn, vomiting, burping, or abdominal pain. Like sometimes we'll hear an individual has GERD, and we'll talk about that later in another slide. So that's a condition where the acid reflux actually goes up, and it can cause problems there too. So there's a very, very quick video that kind of just summarizes everything that were in the last few slides that I think might be helpful to kind of visualize it. Please let me know if you cannot hear this.
Why does food and liquids sometimes go down the wrong way, causing one to cough and/or choke? Normally, food and liquids move from the mouth into the esophagus directed by a precise sequence of coordinated muscle movements. When a swallow is initiated, the epiglottis flips down, protecting the airway. The cricopharyngeus muscle, or upper esophageal sphincter, relaxes and opens to allow food and liquids to pass into the esophagus. Afterwards, the cricopharyngeus muscle closes back up to prevent any regurgitation back up into the throat. However, if the coordinated muscle movement timing is slightly off, liquids and even food may end up going down the windpipe instead of the esophagus, a situation known as aspiration. Specifically, the cricopharyngeus muscle may not open in time during a swallow, causing liquids to potentially aspirate into the airway. Even solids may hang up or hesitate in the throat, causing the person to gag. In an individual who can otherwise swallow just fine, rare aspiration events may occur typically when laughing or laughing and talking while swallowing, when the body wants to both take a breath and swallow at the same time. Unfortunately, simultaneous breathing and swallowing are two mutually exclusive events and leads to aspiration instead.
Okay, let me exit out of here. Okay, so hopefully that just gives a better visual of, the different process involved in the actual swallowing. So I have a quick poll. I'm gonna open that up. So there's, what are common symptoms of a swallowing impairment? So just have a really quick, hopefully you can see this, and feel free to answer this. You can use a chat box too if you're not able to click on the buttons. So So common symptoms of swallowing impairment, obviously there's a lot more to choose from, but you can select all or the ones that you think apply. So choking sensation, shortness of breath, coughing, or repeated pneumonia. I'll give it another 20 seconds to give you a chance to look through that. Okay, let's share the results. Okay, hopefully you can see that. So everyone chose 92% of those who participated indicating choking sensation, yes, shortness of breath, coughing, and repeated pneumonia. We're going to talk about that later on in the presentation on how that can be another sign of a swallowing impairment and how that it actually affects the lungs too. So thank you. I'll go to the next slide because you're going to see, again, this doesn't include everything, but these are just some, some signs that if you might have a client that's might have some issues with swallowing, shortness of breath, that choking sensation, if someone's eating something and they're coughing a lot, especially after swallowing, or you see that it happens, more repeatedly, changes in a voice quality after they've swallowed, and then repeated pneumonia, because that's always concerning. Why are they having so many bouts of pneumonia? Is there something else going on? Okay, here's another poll. What are some conditions that increase the risk for choking? Let me go to the next. Again, same concept as last time. Feel free to choose one or all, or whatever one you think applies. So what are some conditions that increase the risk for choking? Age, missing teeth, a tongue dysfunction, GERD, it's gastroesophageal reflux disease, which we'll talk about later on, history of stroke. Again, these don't encompass everything. These were just some answers that might apply to this question. Shall I give it another few more seconds? Okay, let me go ahead and share results. Okay, good. Yeah, all of these are actually conditions that increase the risk of choking. We're going to talk about some of these in addition to other conditions that weren't listed on here. Age, majority of you thought, tongue dysfunction. Yes, that's going to affect phase one of the swallowing process, right? If there's something going on with the tongue, they can't really help, maneuver things. Missing teeth is a big one. Acid reflux, history of stroke. So all of these are correct. Let's go to the next slide. Okay. Again, this doesn't include everything, but these are just some that we're going to talk about today that actually increase risk factors for choking. Okay, starting with dysphagia. So this is a condition where one has difficulty swallowing. It takes more time and effort to move food or liquid from stomach down, or from the mouth down to the stomach. As they might have, like, as mentioned in the previous slides, history of pneumonia. They might have difficulty, closing their lips when they're, or forming a seal. Some might experience pain when they're swallowing. It might take them more time to chew and to swallow. And all of these are, red flags and can pose an increased risk for choking or aspiration, or a huff and choking. With the tongue helps manipulate the food, and loss of any teeth will reduce the chewing performance, resulting in a bolus, which may, lead to having something that's too large to safely swallow. Decayed or missing teeth all increase the risk, right? Same with, a tongue dysfunction. It might impair mastication, being able to move the food back. And it might lead to like excessive retention of food in the mouth. And, with all of this, food can, become dislodged when the individual reclines and can cause an airway obstruction. So these are our risk factors. We mentioned older adults in the poll. Some studies actually suggest that after falls, choking on food presents as the second highest cause of preventable death in older adults. Although, we commonly associate food choking risk with young children. There's some studies that show that individuals over the age of 65 have a choking incident that's, almost 7 times higher than children ages 1 to 4. So this has, there's a lot of things that affect this. One of those being, there might be a reduction in muscle mass and strength. Those are known complications of advancing age. And that includes, muscles that are critical to chewing and swallowing. There might be, sensory changes and loss of taste. Some might experience, dry mouth. It could be, part of the aging process, and sometimes there's a lot of medications, which we'll talk about later on, that can actually cause, someone to have less decrease in their salivary gland function. And so that can lead to multiple like oral and dental consequences, like dental cavities, periodontal disease, fungal infections. And all of this can really, impact quality, not only, quality of life, but like speech, eating, and swallowing. There might be some older adults that might find it difficult to maintain, postural stability or maintain a head position during meals, which can also increase the risk of choking. So there's, a lot more that, to cover, but these are just some of, bullet points on why this can be a risk factor. Some individuals, with Down syndrome too, dysphagia is often seen, we hear a lot about it with infants and young children with Down syndrome. And for many, this actually can improve over time, but then there's also some that, swallowing related concerns may continue to persist into adulthood for a significant proportion. Another thing to consider is with any of our clients in general, but, life expectancy of, the individuals we serve continues to improve. So the aging process, as mentioned in the previous slide, can also affect, these conditions. So just on this slide are just some factors that may lead to feeding problems and risk for aspiration for individuals with Down syndrome. Like you'll see here, some may have lack tongue control, or may have an underdeveloped jaw, leading to impaired chewing, poor ability to use their tongue and assist with swallowing. Might have a high risk of having, periodontal disease, which, can lead to tooth loss or chewing pain. So just different causes and results that can lead to feeding problems. Individuals with cerebral palsy can also have high risk factors, right? We know that symptoms of CP can vary from person to person, but in general, cerebral palsy, it's a group of disorders that affect movement and the muscle tone or posture. Depending on, the severity of their symptoms, they may be more susceptible to respiratory illnesses, such as upper and lower respiratory tract infections. So the motor control issue that we see with individuals with cerebral palsy, which cause a physical disability, can also have an impact on really all stages of the swallowing process, from the ability to close their lips and chew properly to issues in the pharynx, the larynx, and even beyond. There might be some individuals that have lower activity level than their peers. And so when an individual is unable to exercise in a manner that causes deep breathing, air passages are more likely to become infected, and then the muscles used for breathing aren't fully, exercised. And so this is all, can be detrimental to their overall health. If an individual has like a scoliosis or curvature of the spine, the muscle tone and gravity may contribute to chest wall deformity, which in turn can lead to restricted lung function, and then the potential for unequal lung expansion again can also be detrimental. There might be some that might experience trouble controlling muscle function and may not be able to cough up material that are left in the passageways, which can, in turn increase chances of choking and then aspirating food or liquids into their lungs. The other thing too is acid reflux is also really common in individuals, and certain individuals with CP, which we have a slide dedicated to that, but this can also increase the risk for aspiration. So quickly, I'm going to go over these conditions. So seizures, I wanted to briefly talk about that. Seizures makes up one of the, fatal 5 conditions that have the potential to severely impact a person's quality of life. We do have a whole presentation dedicated to this topic that we'll, shared with you all in the near future, but as aspiration is a possible complication from seizures, which is why I wanted to dedicate a slide to this today for this presentation. So we all know a seizure is an event in which a person's brain experiences a surge or storm of electrical activity, right? Which interrupts the brain's typical functioning. So an individual who have a known seizure disorder may have seizures at any time for no apparent reasons. For individuals who do have epilepsy, anything that causes stress to the brain or body systems could increase the risk of seizures. And, seizures can result in falls, drowning, or other injuries. And a person who vomits during a seizure can even choke on or aspirate their vomit, which can be very dangerous and possibly even fatal. So, although we know seizures aren't always preventable, staff, whether it's in the home or at day program, play a really important role in helping the people they support reduce the risk of seizures or related injuries. A lot of you provide medication support. What can trigger a seizure in some individuals that you serve. So, to help avoid that, know warning signs and just minimize risk of injury. For example, if you care for an individual with a seizure disorder, you may want to recommend, showers versus baths. As you all know, it takes very little to drown. So having a seizure during bath time can be deadly if, they're left alone. So there's just a lot of things that we can do to help kind of minimize those risks. If at any time you do witness someone having a seizure, it's important to help the person, turn onto their side. And obviously don't put anything into their mouth in a person who is seizing. It's important because, some individuals might vomit, as I mentioned earlier, which can put them at risk of aspiration or choking. I'm going to go to the next slide. Some of you do support individuals who have, Prader-Willi, which is it's a genetic disorder that causes obesity, intellectual disability, and shortness in height. And then a key feature of the syndrome is a constant sense of hunger and wanting or, devouring great quantities of food. And so obviously this poses a risk of choking due to some might have, poor oral and motor coordination, might have poor gag reflex, and if they're eating large amounts of foods at a time, there's just a higher choking risk. So another condition we should be observing and assisting to prevent any complications. So we've talked about this previously with the GERD. So this occurs when stomach acid repeatedly flows back into the tube connecting your mouth and stomach, into the esophagus. It refers to the backflow of acidic or non-acidic stomach contents into the esophagus. It occurs when the esophageal defenses are overwhelmed by stomach contents that reflux up and into the esophagus. So I know we talked about this in previous slides, but there's a band of muscles at the junction of the stomach and the esophagus called the lower esophageal sphincter. So this normally, in conjunction with the diaphragm, acts as a barrier to prevent reflux of stomach contents going back up. But if that barrier is relaxed at inappropriate times, or if it's, at all compromised, it's really easy for reflux to occur. I'm sure most of you have experienced reflux. It does happen time to time, but when it happens chronically or repeatedly over time, that's where we might run into trouble and might have, ongoing acid reflux. And so some of the common symptoms include, burning sensation in the chest, feeling like heartburn. A lot of times it happens after eating, and there might be certain foods that trigger it too. It might be worse at night for some, or when they're lying down. We talked about chest pain, upper abdominal or chest pain. If for someone who has nighttime acid reflux, they might experience, an ongoing cough, inflammation of the vocal cords, new or worsening asthma for some. So just a lot of really uncomfortable symptoms. And there's many reasons why individuals that we serve are at high risk for experiencing acid reflux. It could be, a neuromuscular dysfunction for some. It could be, just a lot of the medications that they take, the diet. There's a lot of risk factors to that. There's some studies that suggest, the prevalence of acid reflux in individuals with developmental disability has actually been found to be, close to 50%. Whereas the prevalence of this in the general population is anywhere from 10 to 20%. So it's pretty significant and something to look out for. Let me go to the next slide. And so when left untreated, there can be a lot of serious consequences. Some might develop esophagitis, Barrett's esophagus, esophageal stricture, just to name a few. Esophagitis is the inflammation of tissue in the esophagus. So this happens when the stomach acid breaks down the tissue, causing inflammation and bleeding. And sometimes it'll even develop into an ulcer, which is, really painful and can make it really difficult to swallow. When there's chronically excessive acid that's refluxed up into the esophagus, scarring can occur after, repeated inflammation. This scarring can actually produce damaged tissue in a form of a ring that narrows the opening of the esophagus, and that's hence, the esophageal stricture. The scar tissue, obviously, if you put that in with the scar tissue there, it will actually narrow the food pathway, right? And it can also lead to problems of swallowing or feeling the sensation of like food getting stuck in your throat, or in some cases, episodes of choking. So those are, obviously can have negative effects. Barrett's esophagus, it's damage from acid that can cause changes in the tissue lining in the lower esophagus. All of these changes can actually increase the risk of developing esophageal cancer. So that's also not good, right? And then another very serious complication is aspirating the stomach contents and, having it go up and into the wrong pipe and down to the lungs, which, can lead to pneumonia, which we'll talk about more in the next few slides. So there's a lot that can be addressed in regards to medications. We're just going to touch on a few common medications that our clients may be on regularly that can actually, have an increase in choking. So any medications that affect the muscles of the esophagus, which are, involved in any that are involved in the swallowing, can increase risk of choking. So medications, anticholinergic medications, there's certain medications for the treatment of Parkinson's. It's used for movement problems that are side effects from other medications, but can potentially, cause problems with swallowing. Medications that may cause dry mouth, which interferes with swallowing. So like antihistamines or medications commonly used for like cold and allergy symptoms. Some antipsychotic or neuroleptic medications can also cause dry mouth. There might be some medications that are used for psychiatric disorders or seizures that may also, slightly decrease the voluntary muscle control that affects swallowing. Medications used for like chemotherapeutic for cancers may cause muscle wasting or damage to the esophagus and might, suppress the immune system, making the person susceptible to infection. So these are just a few just to keep in mind. So we've talked a lot about aspiration and pneumonia and wanted to dedicate this slide, kind of going over what it is. So when we talk about pneumonia, it can be due to aspirating food, liquid, or even one's own saliva. And it's one of the, very serious complications of swallowing dysfunction. So this can lead to airway obstruction. And then of course, like pneumonia, like we keep talking about, it's a common event and sometimes can even occur silently, during someone's sleep. It's believed to be one of the leading causes of mortality in patients with dysphagia secondary, especially if they have a neurologic dysfunction. So it occurs when, if you have gastric contents or food or anything that, accidentally enters the lower pulmonary system, because then it brings with it, organisms like bacteria that don't belong there, or other harmful substances, which can lead to inflammation and then infection of the lungs. Aspiration can cause severe lung damage and more seriously, acute respiratory distress syndrome, which is an inflammatory lung injury that happens when fluid builds up in the small air sacs in the lungs, which prevents the lungs from filling up with air and causes, very dangerously low oxygen levels in the blood, which then prevents other organs like the brain, your heart, kidney, stomach from getting oxygen that they need to function. So it's very, very dangerous and can lead to a number of serious and life-threatening problems. In some instances, patients may have to be, intubated and placed in the ICU and on a ventilator to help them breathe while they recover. And some patients may be able to be removed from the ventilator and breathe freely on their own. And then some might take, might not recover completely or might develop chronic lung, problems. So, as you can see, can be very, very serious, but it's important to understand what the consequences are and essentially things that we can do to help prevent it. Okay. One quick polling question. So we're going to switch over and talk about, behaviors and some things that we can do to help with the prevention of aspiration and choking. So feel free to type in this answer, what are some behaviors that you've seen that might increase the risk of choking? This one, it's more of, you need to type in an answer instead of a. I'll give it another few seconds. Okay. I'm going to go ahead and share so far what people have typed, just for the interest of time, because we still have a lot of other things to cover and want to make sure I get through everything. So let's see if we can see this. Oh. And I apologize. I think I exited out of that. Okay. That didn't work too well. Okay. It's okay. We'll go to the next slide. If you typed in something that you didn't see on this next slide, feel free to use the chat box too. Because I'm sure there's a ton of things out there that can increase risk of choking, and this doesn't cover everything, but placing too much food at one time, not chewing food well enough, stuffing food, large portions of food, eating or drinking too fast, not paying attention when they're eating. The other big one too is there's some individuals that might, whether it's at program or at home, that may want to eat by themselves and may move away or want to eat alone because they feel maybe they're embarrassed relating to their eating habits or whatever it is. That can be a risk factor too, because we're not seeing them, so it's important to check on them frequently if they end up moving away from the dining area. Another one is thank you, Jen. Laying flat after eating or drinking, right? Later on, we're going to talk about what are some things that we can do to help prevent risk of choking or aspirating. And one of those is going to be, waiting at least 30 minutes before you lay down or go to sleep after you eat to make sure. Yes, Maxine, that's great. Trying to talk while mouth is full. That's not a very good idea. That can easily cause someone to start to choke. So there's a lot of risk factors that can increase the risk of choking. Okay, really quickly, and I won't use a poll for this one. What are some foods associated with choking risk? You can use a chat box on this. Yes, hot dogs, that's a big one. Here, I'll go on to the slide, and if you don't see something that you're thinking of and it's not on here, feel free to use the chat box. Yes, grapes, candies, hard nuts, meat is a big one, hard candy, even hard fruits like apples, vegetables, there's carrots, raisins. There's a lot of foods that are out there that can really increase the risk of choking. In one study that I found, it's foods that are consistently associated with choking and reported on autopsy findings include meat, bread, sandwiches, toast, among others. And the reason why is that they share, their complex fiber structure that if it's broken down most effectively by chewing using your molar teeth. And so for many, it can take at least 20 chewing strokes per bite to sufficiently prepare a bolus for swallowing when eating something like meat. So you need to have enough stamina to be able to do this with each bite, which can be difficult for some. Peanut butter is also a huge risk. I know it's really like, I love peanut butter, but it can be dangerous too. In a study of that I read online of several, food textures, peanut butter is actually one of the most difficult food to swallow because it requires more muscle strength and tongue coordination. So that's another risk factor. Strategies. So what can we do to help the risk of choking? So please feel free to type in the chat box anything that you don't see on here, but making sure that, clients don't feel rushed during meal times. If at any time someone's eating and they start to, choke, don't let them finish that. Maybe there's something, they're not able to fully, chew and swallow it, and we might need to give them something else. Avoiding or modifying, not that we have to completely avoid some of the high risk foods, but grapes is on there, right? If someone really likes grapes, but we know that they're a high, we're afraid that they might choke on it, we might need to cut it up into smaller pieces so it's easier for them to chew. Not eating or drinking while they're lying down. Sitting upright and waiting, after they're eating before going to bed or laying down. Wet pillows for those, to sleep on. It can really help alleviate the symptoms of reflux, especially at night. So by slightly elevating, the head, the shoulder, like the shoulders and the torso during sleep, it can help prevent acid from leaking out of the stomach and into the esophagus. Some individuals with history of aspiration maybe place some aspiration precautions by their doctor, and so they're going to recommend that there is a protocol in place during eating where they only take really small bites of food and small sips of drinks, or modify their food, making sure that they swallow everything before they take another bite. Small frequent meals throughout the day. If someone's taking several medications in a pill form, they may need to consume one pill at a time instead of taking, several. So there's a lot of things that can be done. If at any point you have a client that might be at risk for choking or aspirating, they really should be evaluated by the healthcare provider. Even if you have the slightest indication that there's something going on, it's better to just be precautious and get them assessed, because a doctor could then refer them to, a speech language pathologist and your nose and throat doctor, or even a gastroenterologist to best assess their particular condition. And just checking in with them to make sure, that there's a person-centered support plan, or, in a choking protocol to meet their specific needs. So let me, just in the interest of time, let's go over to the next few slides. Another thing too is, caregivers should be certified annually in CPR in the process of administering back blows and abdominal thrust for choking emergency. Doing practice drills or mock emergencies is really helpful. And then just allowing staff the chance to ask questions and building confidence, just in case you're ever in that unfortunate situation where you have someone that might be choking, you can react to it instead of, not doing anything or not knowing what to do. Repetition of this can give them a chance to improve their reaction and response times. Some suggestions is maybe, depending on the situation, maybe having posters up with clear instructions on what a caregiver should do during an emergency, with like maybe visual reminders. If someone's choking, knowing the universal choking sign and what they need to do next. There's a lot of information online on, choking emergencies. If someone's choking, letting them, hopefully they can cough it up, and that might, help remove the stuck object. If they can't do that, giving them the first aid. if you take a CPR class, you know, the American Red Cross will give, you know, recommendations on what needs to happen, giving back blows, and then if that doesn't work, abdominal thrusts. And then there's also a lot of techniques on what should happen, you know, on for adults versus children or infants, versus we'll see on the next slide, someone who's, you know, on a wheelchair. Let's see if I can go to the next slide. Because that's always concerning too. We might know what to do with someone, you know, who's not in a wheelchair, but how would you help someone who's choking, who's in a wheelchair, to help remove that obstruction out of the airway? And so making sure that caregivers are trained and know what to do to take the next steps. Like in this situation, you know, if someone's in a wheelchair, making sure you apply the brakes in the wheelchair, calling for help. If you can, leaning the user forward and you know, slapping them that way 5 times. And if they're still choking, I think the other recommendation is standing behind the person and wrapping arms around them, and do the abdominal thrusts. And so there's just different techniques that we should be practicing with staff so they know what exactly they need to do. And the last few slides, I'll share some resources and address an upcoming training that I think everyone should take advantage of. But let me just go on the next slide, and then we'll talk about the resources next. I wanted to share this slide too. It's the dechoker. You've probably seen it pop up, you know, online, but it's a device that can be used for choking first aid on anyone 12 months or older. Technically, this should be used if back blows and abdominal thrusts aren't successful in dislodging the blockage, or you have an individual where you can't physically, you know, because they're in the wheelchair, maybe their size, you can't physically, you know, bend them forward or try to do the abdominal thrust. This is another technique that can be used that requires minimal training and does come with easy step-by-step guidelines. It's not covered by insurance at this point that I'm aware of. It is about $50 a piece, but it's totally worth having for someone who's serving, you know, an individual that's high risk, and you can foresee there being complications if they were to, you know, accidentally choke on something. I was going to show a quick video on it. But I don't know if we'll have enough time, but if you are interested at all, I would highly suggest you go onto these websites. It's the dechoker.com or dechokertraining.com. There's an actual video on how to use it. You know, you can see on the right-hand side, it's the face mask. So you actually place that on the person's face, and then kind of with the little plunger, pull it out so that it can, in essence, pull out and dislodge whatever is stuck in the airway. But please, I would encourage you all to take a look at that online. And, you know, get a chance to look at the video and really consider, look at the clients that you serve and think, you know, is this something that would be beneficial for them if I were ever in that circumstance or in that emergency? I did want to talk about this, was just shared on the FNRC Facebook page on CPR training resources. That's coming up next in the beginning of, in January, actually, the first class will be held. So the California State Council on Developmental Disabilities teamed up with Self Advocates for Emergency Education and the American Red Cross. And they're offering 6 different chances to learn more about hands-on only CPR. These classes will be offered on the 2nd Friday each month, starting in January. So I pasted here all the dates where it's going to be offered. The registration, I put the link on here, but if you have any issues with it, I would encourage you, you know, if you need to refer back to it, on our Facebook page, FNRC Facebook page. It was just shared yesterday, so you can go back and look at that. I highly, highly encourage you and your staff, whoever can, attend this. I think they are only limiting each class to 30 participants. So if you're interested, I would, go and register now. One of the things I did see on the flyer, it's, because I'm assuming it's, because it's all on Zoom, participants are going to be encouraged to find like an empty disposable water bottle, or like a toilet paper roll or something to use as part of the training, so that you can, I'm assuming they're going to have you actually, practice doing like chest compressions and all of that. So anyways, I just wanted to encourage you all to please look at this and consider signing up, because I think this will be really beneficial for you and any staff that's interested. And then last slide, again, just can't stress enough having staff trained in CPR. I know for some of us to get certified, there is a minimal cost to it, but I think it's totally worth it. There are a lot of online resources as well. If you want to look at, American Red Cross, there's the National CPR Foundation, or eCPR certification. I did find that it was another online training course. I think it was fairly simple. If, as a last resort that you can't attend, a training in person, that would be another suggestion. So I know we're just at the top of the hour, but I'm happy to stay back, and if anyone has any questions or comments that you'd like to share, I'll open it up. You can use a chat box or unmute yourself. Let me see if there's anything on here. Okay, someone asked about the anti-choking devices. Yeah, I mean, I think it's a really good resource, especially for our more high-risk folks. Could be really beneficial to have on hand. So we don't, the slides aren't going to be shared, but as we mentioned earlier, these classes are recorded, so you're always welcome to go back and look at the video, or if you need staff, to go back, they can always look back at the video on our YouTube page. This should be saved up there in the near future. Okay, well, if we don't have anything, I again want to thank everyone for taking the time to join us today. It's always good to at least see names attend this. We will be having another one next month, and we'll continue our 5-part series on the Fatal 5. So please register for that now, or have other staff or other providers join it. That would be great, so you can spread the word, and we'll send out reminders once we get closer to that date as well.
Thank you so much, Nellie.
Thank you. And thank you, everyone. I hope you all have a great holiday.